Welcome to the PharmaVOICE 100 one-on-one video series with Taryn Groen.
Hi, Shannon. Thank you so much for joining us for the PharmaVOICE 100 Celebration Marathon.
Hi, Taryn. Great to be here.
Good to see you again. Shannon, I know you and I have talked in the past about the number of patents you have. In fact, it's more than 20 to date to your name. So you really are the epitome of an innovator. How do you approach the ideation?
I'm sorry, I'm going to stop you, Taryn. I'm going to let you go back to the beginning and start that again because it's more than 30.
More than 30? Oh, I'm sorry.
Yeah, that's okay.
My God, you're prolific. You need to... What the heck? You dream these up in your sleep? My God, woman. All right. Okay. Hi, Shannon. Good to see you. Thank you so much for joining us for the PharmaVOICE 100 Celebration Marathon.
Hi, Taryn. Great to be here.
Shannon, with more than 30 patents to your name, you are the epitome of an innovator. How do you approach the ideation process?
Well, I think it starts with being really clear about the problem you're trying to solve, and then being intentional for solving for it and borrowing concepts to create solutions. So for example, on the problem, we're targeting a specific unmet clinical need. What is the pathophysiology behind that need? What are the developments or advances we have to make to change that pathophysiology to be able to make a meaningful difference for patients? If there was already a solution there, then we wouldn't have to invent something new. But in most cases, by definition, when we're addressing new unmet needs, we are creating new solutions. And that really lays the foundation for some IP. If we then use this unmet need as our true north during development process and take the example of working through new products, it's an iterative process. We'll have an idea about how to create a solution, and then we'll gather data on it, and we'll see where are we, where do we still need to be. And there's always some hurdles and challenges along the way, and those are also opportunities for new solutions and new IP. So, for example, if we face a challenge, how might we borrow a concept from another field or another sector of our own field and apply it in a new way? I think one of the great foundational examples here is in the case of bioreactors. You know, this was a technology that was used in the beer industry long before it was used in the pharmaceutical industry. And so it's that idea of borrowing a concept and applying it in a new way that we can really use throughout the process as we're developing new products. If we then are just going through this process, I think the last step is to be mindful, you know, being reflective about where are there new learnings for us? Where did we make advances? Where were those advances non-obvious? And those new foundations that we create new compositions of products or new methods or new ways to use the products, that's all the foundation of IP. So again, it's really about knowing the problem you're trying to solve, working through the challenges and borrowing solutions, or in some cases creating new solutions, and then being mindful about recognizing where those novel pieces are.
Fascinating. Thank you so much. Those are such great insights. So my next question is, how do you inspire your teams to reach beyond their self-defined goals, since you are really creating new pathways all the time?
Yeah, well, again, I think it always starts with having really clear big picture goals. What does the company need to achieve to move new products forward for patients and really move patient clinical care forward? How is each team and each individual contributing to that process of moving it forward? When we connect the individual goals to the company goals, I think it creates a clear sense of impact and purpose, and that creates a really nice, positive, virtuous cycle of a shared vision where we're really committed to moving forward together. And when we're committed to moving forward together, then I think the goals naturally expand beyond an individual's goals and really into an opportunity to grow in ways that you hadn't considered before. For example, it reinforces the importance of how we work. What is the company culture? How do we prioritize and make decisions? You know, often there's a lot of opportunity for growth in how we work, in developing personally, in developing others, and developing new structures or cultures for the company. Perhaps it's in developing operationally or in developing with a more strategic orientation. Also, when we're committed to moving forward together, there's a lot of opportunity for cross-functional interaction.
For more PharmaVoice 100 content, visit www.pharmavoice100.com.